Hi, welcome to our brand new Community 7 show, Our Planet, Our Health, where we talk to normal Montanans who are working to address climate change across our state and sometimes across our nation. I'm Lori Byron, a pediatrician that's been caring for Montana children for many, many years.
And I'm Rob Byron, an internal medicine specialist who cared for the parents of Lori's patients for that same number of years in southern Montana. And together we'll be your co-hosts for Our Planet, Our Health, which will feature conversations with people from across Montana. Most will be healthcare professionals working to protect health and safety, to make people aware of how air pollution and the climate change that it's causing are impacting our health, and to address air pollution and the climate change in their own actions. But health involves us all, not just healthcare professionals. With that in mind, some of our guests will be inspirational people who, while professionals in their own right, are not healthcare professionals, but are still working to improve health.
So we'd like to introduce our guest today. We're honored to have Julia Ryder. She's a registered nurse, a mom, a wife, and wears many other hats, including a cowboy hat sometimes. Julia, can you start out by maybe telling us where you grew up and what your childhood was like?
Yeah, I grew up in the Midwest in Wisconsin. My family was very much surrounded by farmland since my family members were farmers. And in my early 20s, I began drifting from more agricultural life into more of a outdoor life in any form I could get my hands on. I graduated from University of La Crosse, Wisconsin, with a psychology degree, and immediately went into wilderness therapy, where I spent most of my days I slept under the stars, more days than I slept under my ceiling at home. And then from there, I began working in southern Utah as a bike guide, and from there, I drifted into nursing. So I've always been very much a person that wanted to be part of the land in any form possible.
Okay, thank you, Julie. And you've told us about growing up. Can you tell us a little bit about what brought you to Montana and also about your family now?
I have a very cute small family right now. I came to Montana, I had finished nursing school in southern Utah, was looking for work, and a dear friend brought me up here. And then I met my husband up here, and we have a little girl who's 4 and a half if you ask her. That's actually very important when you're 4 and a half. And we also include in our family our 2 dogs, and we include our 2 horses, because they're very much a part of our life. And so our family, while we just have 1 human child, we consider ourselves having 5 children.
So what did you learn from your parents, and how do you think that affected your life up till now and your career choices?
That's a great question, because my parents lived a very different life than what I live right now. They were very simple, I would say. Growing up in the Midwest, we were not a wealthy family, like many of us weren't. And my mom made everything, at home, like right down to our clothes, which sometimes when I was a kid, I didn't appreciate, but now that I'm an adult, I understand the skill that took. But also just our food. We were very much in connection with where our dairy and our meat came from, because a lot of it came from family members. Also growing up, I learned just about the importance of living a simple life, and I think I will always appreciate that about my family. My family continues to have a strong faith, and so no matter what my faith is now, I know that they always kept family first and their faith important, and I think that carries into living in Montana. And I often feel like I live in a very similar culture as I did in Wisconsin, just this one has beautiful mountains.
Yeah, thank you. And Julie, you've kind of given us an idea of where you come from and some of your interests, but and we know you're a nurse.
Yeah.
Tell us a little bit about what brought you to do work in the environmental and climate change areas.
Yeah. It took me a little time to figure out that decision for myself. As you know, I was a backcountry mountain bike guide, which is very cool when you're in your 20s. And then you start to realize that you have to retire one day. You have a sort of panic. And my poor parents, their love for me didn't fade through all that. But I'm sure I scared them a little. But what I learned from that experience and for wilderness therapy is that it was very much, as I was raised, about land. It was a very different way to experience the land, but it was still about being one with the land, because you were relying on weather, you were relying on the rise and fall of the sun. I was probably more attached than ever to what was happening outdoors because it affected my comfort level that day. Much like my relatives who were growing crops or raising dairy cows. It was just a big part of our life. And so I was able to transition those two worlds. It was really helpful. Went into nursing because at the heart of it, I'm a humanitarian. I also love animals, so I'm just an over-nurturer by trait. And it just felt like a great way to express that over-nurturing, but also watch out for my community. And like I said, be a person that is able to give to other people. The climate came a little bit later. I had a steep learning curve as a nurse, especially working in an emergency department. You have a lot to learn, a lot of critical skills to learn. But over time, I started noticing that it wasn't about the traumas. We weren't getting those as often as we were getting children coming in with asthma attacks. And we weren't getting the heart attacks because our out of care American Heart Association does such a good job of teaching bystander CPR, and we have such good paramedics. That wasn't the portion of the ER. It's a small portion, and we do a great job with that. But I was also seeing people that were struggling from loss of land and mental health issues. Our summers are hot in Montana, and I've been in Montana since I started my job here in 2011, and just noticing that each summer felt a little more extreme, but also paying more attention to how it was affecting our patients. I live in Bozeman, Montana, and the population has almost doubled in size, and the patient population, I was just seeing more and more of these same issues. Heat stroke, exhaustion, children struggling with heat, but also with respiratory illnesses, people that were traveling to come in for weddings during wildfire season, coming to our ER because they didn't understand why they were short of breath, blaming it on travel, not recognizing that if they don't come from a place that has wildfire smoke, how much that affects you. So I got curious. I also got curious because as a nurse, I knew there was a connection between my understanding of the planet or the outdoors and what I was doing for work. And so I dived into that, and yours was one of the first organizations that I found and guided me to get more information and inspired me to start doing this work. That was a long answer, but I'm finally there, and each day I'm learning that there is a direct connection.
No, thank you. And I think you did a beautiful job of helping our audience also to understand some of those connections between more heat waves or more heat, more pollen, more dust, and our health, whether it be our children, our own, or our friends. So I think you did a wonderful job. Thank you.
And so you're a student now. Can you talk a little bit about that?
Yes, I call myself the forever student because when you have 4 fur children and one real 4.5-year-old daughter, you're very busy, especially when you're working. So I went to public health. I chose public health, a master's of public health as my next step to work through more the climate connection between health, because being on the front lines in the ER, you feel very hopeless because we try to fix things, which is a lot that we can't fix because people are gonna go back home to the same environment and have the same symptoms if we don't teach them what causes those symptoms. The piece of public health that I found would be valuable to help as a nurse and to be a better nurse for just my community, my own family, was to be preventative. So public health has this, so I'm getting a master's in public health, and it's teaching me how to share information and disseminate information to not just my patients in the ER, but also to my neighbors and to the people I, go to the same grocery store with and the same parks with, so they can protect themselves and prevent them and their children from going to the emergency department. So it helps me with language, it helps me with understanding more about environmental connections to health. It's giving me resources that I can now share and give tools to patients, hospitals, my friends, things like that. So I am working on and just about done with a Master's of Public Health as the forever student.
Can you give an example of something maybe that you've learned in school that you're already applying in your work or your away from work life?
I can. Information is sometimes overwhelming to give to people, and in the emergency department, we're very short of time. So giving that information, you're quick, you're to the point, you get the patient out. What I've learned from public health is it takes people multiple times to learn a piece of information, and they need multiple ways to have it brought to them. And so what I've learned with public health is how just better ways and better platforms to share that information. So when a patient leaves the emergency department, I can guide them to, if you are looking to get better indoor air quality for your home because your child has a sensitivity to allergens, this is a website you can go to. This is the local public health department that can assess the indoor air quality of your home. Those are options I've learned from my degree. But I've also learned a very interesting thing about public health is you really study how people accept information, how people have to take it in phases, and how there's a lot of people that don't accept information until, say, they see a close family member accept that information. So it's so much about continuing to share the information in multiple ways for people. So, and for me, us living in Montana, wildfire is a really big, important thing to try to share and keep kids safe. One thing that I've done that's really helped, another platform that I've learned also from this organization, Montana Health Professionals and Healthy Climates, was the air quality flag program. So one way is you go to public schools, medical centers, just important organizations that are also helping people and say, when the air quality, on the air quality index on your phone, your computer, all these gadgets we look at every single day are showing the air quality is bad, we can hang a flag of that air quality. And that is simply a way to tell people we're watching out for you. Maybe wear a mask when you go outside and take your walk. Maybe recess is shorter for public schools. So again, it's just public health helps find multiple platforms, and then as your organization does, it works through those platforms to keep the education going even after people are discharged from a hospital and giving them more resources.
Thank you. You did a beautiful job of connecting those to you. If we could, let's shift a little bit,
Sure.
If we can, and that is, tell us about some of the work that you've been doing, particularly in the climate change and sustainability areas.
Yes. Well, as a mom, the more I go to school and the more I work on, one of my certificates through my public health program was environmental health. It has changed my everyday life. It has changed the way I see my child growing up. I'm much more conscientious of my impact currently. And when I say my impact, I'm saying how I use my resources, such as my food resources, my shopping resources, because I know that my child will have to take on those resources as an adult, right? So anything that whatever I take, maybe I'm not describing this correctly. I'm trying to teach her, say, food. We want to support our local ranchers and agricultures because we want our food sources to be taken care of and protected. And so hopefully I'm passing that message on to her. So by the time she's an adult, they have been protected. So she can still eat her meat from a local Montana ranch, and she can still get her her vegetables from a local farmer. And so she still feels a connection to the place that she's growing up. And so that's changed my practice that way. Things I do for work, I have worked with my local hospital on sharing this information with patients. So I have contacted the board of the hospital and multiple different physician committees, and we have agreed to share with patients in all clinics handouts. So when patients leave the clinic, they can see how to take care of themselves during wildfire season, how to take care of themselves through high temperatures and heat, how to take care of themselves through drought, especially our agriculture and our ranch people that really feel that significantly because that's their economy. So I've helped get those pamphlets out. We've also done, I would say, Rob, you also shared with me an indoor environmental panel recently through the Bozeman Health Sustainability Committee on trying to help people say if you have poor air quality outside, you need to go into your house, but let's make sure that air quality is also good. So you're not just escaping from one bad air quality to another, but how to keep that house air quality good as well. And then just also I've given multiple talks across the state to other nurses and peers and physicians on the connection between how us healthcare providers can also reduce our personal impact. So a health facility isn't causing harm through copious amounts of waste, using toxic soaps and cleaners that might affect our patients or our water systems, and sharing the information and getting people excited about how we can be empowered and make change so we don't have to see Montana as being lost to climate change or drought or heat or toxins or waste, but we can actually make that change. So just helping empower my other peers and coworkers and other healthcare providers.
That's great. That's great. Nurses are such great educators. Can you tell me why nurses should care about this topic? And do you think they care about this topic?
My experience has been nurses really care about this topic. I think because all of us nurses are seeing patients on the front lines, but I also feel that a nurse's job is to advocate for our patients. We get orders from a physician, the physician does the disease process. A nurse, it's not our role to figure out what disease process is going on, what medications prescribed. It's our role to teach patients. It's our role to help them transition from a hospital bed to home and feel safe and feel like they don't have to come back. I do think that the primary job of a nurse is education. Yes, we know a lot about disease process and medications because we give them and we want to know why we're given what meds we're given and help to do that, but we're also very much the people that are helping our patients transition in between each step of their care. What I've noticed working with other nurses is they get very excited when I say, let's get some resources on heat, let's get some resources on air quality, because maybe we don't want to call it climate change, or maybe that's a weird word to use because it's become politicalized, but I would say we're all feeling the effects of maybe heat, weird weather patterns, floods like Livingston had a couple years ago. We're all feeling these effects, and I think not talking about it makes us feel more depressed, but when us nurses feel like we can do something and be helpful and take part of that process, not only is it selfishly it makes us feel good, but we also feel hope for our patients and give them hope. So that's one reason we care. The second reason is for those of us that work in a hospital, it is shocking the amount of waste that a hospital creates. It is heartbreaking to watch how fast one patient, and it's not because they're a problem, but because of our system, we will fill up an entire trash bin of plastic that is, it's like a 30-gallon trash bin easily, and we go through thousands of those a day. And so I think it's hard to look away from the waste. It's so in our face. We're a part of that. And when you give someone a solution and hope that we're not going to just use up our landfill, that we can actually have places to build homes, It feels good. So I think nurses, I think because we truly care and we are the advocate for the patients, I think it's a good place for us to start with helping patients be healthy outside the hospital. And then I've really learned that I work with a great group of people that care, and I would say our physicians deeply care as well, but it's a nurse's job to help break that information down and advocate for that patient in ways that we can and know how as they transition, to their discharge and back home.
Wonderful. Thank you for doing that. Julia, if I could, I want to focus on one thing that you talked about a little bit, from your perspective as a nurse, you talked about people coming into the emergency room. You're seeing more issues related to mental health, and you mentioned drought specifically. Can you talk just a little bit about that, of what you're seeing?
I think I'm seeing, from my personal experience as an ER nurse, I think I'm just seeing the tip of the iceberg of mental health in our state. I truly don't believe the people that are struggling with mental health have the time because they're working or have access to what they need for their mental health, but we are seeing their children come in. So we are seeing intergenerational stress. I would say living in a town that's a university town, a lot of college students coming in and have been holding on to stress for a long time, that their family's fighting to keep their land, keep their ranch, to survive economically wise, because it takes money to put food on the table, we all know that. And if your income is your farm or your ranch, and if you have weather patterns that are making it more difficult to grow food or to raise your cattle, that puts a lot of stress on a family. So what we're seeing are these younger students, university students, even some high school students that do come in. They talk about the family stress that's been going on for them, but it has significantly impacted mental health down the lines. What I would say is, what I have learned in public health is that stress we can transfer to our children. It's intergenerational, and mental health is just as important as any other disease process we have, but we tend to have more of a stigma around it. And I do think as healthcare providers, we don't share that stigma as much, but I don't know if the general population feels it's safe to share mental health problems, and it does show up in families. So we're seeing children come in with suicidal ideation, and then you learn along the way that their family's just been under a lot of stress. And so we're not seeing probably the parents that might want to have the talk, but we need to share those resources. And so again, I work on a preventative mode now, being in public health, and I do think that if we can reach more families and their parents, then we may be able to prevent some of these kids from coming in with that stress and depression.
Great. That's a lovely segue into, you're not dressed for the Bozeman ER today, I think. You might be dressed for some activity that brought you to Billings today. So tell us what you're going to be doing.
I am. I get to go to the Montana Stock Growers Annual Convention today here in Billings, and I get to share these resources. Again, I'm going to come from a nurse perspective and just offer tools to farmers and ranchers if they're out there working, that they know the heat index and when to get out of the sun, when to ask their employees to get out of the sun, how to protect their children, their livestock, and themselves from air pollution, what they can do so they can keep working, but how to limit those hours or what hours of the day to go to. So, and then I get to share some work on drought and mental health that Montana Health Professionals has done and the research on that. So I'm excited to share with the community that takes, community of ranchers and farmers that take care of us. I'm excited to help take care of them a little bit too.
So Julia, thank you very much. We're about out of time, but thank you for sharing your time, your expertise, and yourself with us and with our audience today. One last question,
Sure.
and that is, what would you like people to take from our conversation today? What can people do?
I mentioned briefly that climate change, the word has become pretty triggering for people. I don't want to come from a perspective of climate change. I want to come from a perspective that we're all in it together. And Montana is a beautiful state, and we have beautiful pieces of land and agriculture. And I just want to show that when we join together and take care of one another as a community, that we can help everybody thrive. We can support our agriculture people, we can support the ranchers, the farmers, the people that give us this beautiful land, but also support anyone that's moving in. So I do think coming together as a community can really benefit human health in the long run, and the outside climate effects from it, or environmental effects from it. I do think community can save us all.
Thank you very much. So this show is brought to you by the Montana Health Professionals for a Healthy Climate, and we have members across our state who work to educate on the fact that climate change and air pollution does affect human health. And we want to let people know that, and we also want to find ways to protect human health from conditions that are happening on our climate now. Thank you very much.
We are Montana Health Professionals for a Healthy Climate.
As a pediatrician, I care about a healthy climate because I worry about our future generations.
As an internal medicine physician, I care about climate and health because people's health is suffering needlessly from our warming planet.
As a clinical psychologist, I care about a healthy climate because I want to promote resilience in our young people and communities.
As a nurse, I care about climate and health because our warming planet is causing more suffering and illness, and I want people to thrive.
As a physiatrist, I help people with pain and disability maximize their function after illness or injury. I care about climate and health because Montanans with disabilities are disproportionately being harmed by the warming climate, and we can change that.
As a pediatrician, I care about a healthy climate because I'm concerned about the health impact of climate-related events like heat, wildfire, and natural disasters on our kids.
We advocate for health.
We work across Montana on health and climate.
We work with other groups.
We donate our time and resources.
We hold a climate and health conference every year.
We are leaders about health and climate.
As our vision statement says,
We address climate change to build a healthy and just Montana.